Giesa, Assistant Professor of Anatomy. Now I will talk about the movement of the ankle joint and the applied anatomy of the ankle joint. We have already discussed about the gross anatomy of the ankle joint, in which we have told about the bone which take part in the formation of the ankle joint, about the ligaments, the medial ligament and the lateral ligament, and also about the relationship of the different tendons, the nerves and the blood vessels for the ankle joint. So now we will talk about the movement of the ankle joint. Since we know that this ankle joint is made for hinge-like movement, it has got a hinge movement. It is example of hinge joint. So what is that hinge joint? Hinge joint is that means we do this movement and that movement, this movement and this movement, like the door of a room which moves like this and that. You open it and you close it. You open it and close it. This movement is known as the hinge movement. You do this and that. Now, suppose if I take this is my foot. This is my foot. So what if I can do this movement? I can do this movement and this. Both the movement is known as the flexion. Flexion means when the two surfaces comes close together. This is known as the flexion. And in case of the ankle joint, we don't have the extension of the ankle joint. We have got both the plantar flexion and the plantar extension. We have got the plantar flexion and we don't have got the plantar extension or dorsiflexion. We have got the two movement that is known as the dorsiflexion and second is known as the plantar flexion. So both are the flexion, means the two anatomical surface will come close to each other. So now about this is the normal anatomy of a ankle joint. This is the normal anatomy of it. This black line shows the lower end of the tibia. This shows the lower end of the tibia, and this here blue line is showing the trochlear surface of the talus. What is the trochlear surface of talus? The upper surface, the superior surface of the talus, which comes in contact with the inferior surface of the tibia, forming the ankle joint, is known as the trochlear surface. And actually, this trochlear surface it comes in contact with the inferior surface of the tibia. So now we have got this is the trochlear surface of the tibia, and you can see that this is snugly fitted into the lower end of the tibia. So there is no chances of the dislocation. So this is the normal anatomical position of a foot. Now the movement. Now in case of dorsiflexion, what happened? The anterior surface of the leg. This anterior surface of the leg is known as the dorsal surface. This normally what the dorsal surface is, the back is the dorsal surface. But in case of the lower leg, this surface is also known as called the dorsal surface. So this flexion, this movement, when you raise the foot. And when the foot comes in contact with the lower leg, comes to the lower end of the tibia or comes to the lower part of the leg, this opposing is known as the dorsiflexion. You see the angle over here? How much angle is here and how much angle over here? If you will measure it, then the angle between the lower part of the leg and the foot is much more than the angle between the lower part of the leg and the foot in cases of the dorsiflexion. So what happens in case of dorsiflexion? The angle between the space between the angle between the lower part, the foot and the leg get diminishes. And the trochlear surface of the tibia, becomes more in contact with the lower end of the tibia comes more in contact with the lower end of tibia, you see the lower end of tibia is right over here. So it has got more superiorly, that means the more surface, the much more surface of the trochlear surface of tibia is in contact with the lower end of or inferior surface of the talus. That's why the congruity means the two articular surfaces coming in contact with each other in case of dorsiflexion is much more. So there is a minimal chance or no chances of dislocation in cases of the dorsiflexion of the leg. Now what happens in case of plantar flexion? Now we move towards the plantar flexion. Plantar flexion, this is leg and this is foot. What happens in the plantar flexion? The toe goes towards the ground, and the heel is raised. Toe goes towards the ground and toe is raised. Means you cannot call it as the dorsi extension. We call it as a plantar flexion because the plantar surfaces are opposing to each other. These surfaces are coming close to each other. This surface, you see the angle from here to here, and here to here, it is much less. So this is the plantar flexion. This is not the dorsi extension. In case of the plantar flexion, you see over here, the space. This is the lower end of the tibia, and this is the talus. And what happens? The minimal portion of the talus is in contact with the inferior surface of the tibia. Much of the space, you see, the more space is available over here, the more space is available at the inferior surface of the tibia. The more space is available over the inferior surface of the tibia, so the chances of dislocation is much more. So in a lady, we have a high heel shoe, the chances of the dislocation of ankle joint is much more. Now we will talk about the muscles. So the two movements are only two movements in case of the ankle joint. One is the dorsiflexion, other is the plantar flexion. In case of dorsiflexion, the congruity of the ankle joint, the congruity between the lower end of the tibia and the upper end of the superior surface or the trochlear surface of the talus is much more. You see, in case of plantar flexion, this congruity diminishes even than the normal condition, and the more space is available at the inferior end of the lower end of the tibia. So there is a high chances of dislocation in this case. So a lady wearing a high shoe has got the high chances of dislocation than the normal severe normal flat foot. So now the muscles which are responsible for producing the dorsiflexion and the plantar flexion. Now you see all the muscles which are on the anterior part are responsible for doing this sort of flexion. All the muscles which are on the anterior surface of the tibia are responsible for doing this movement, and all the muscles which are on the posterior side are responsible for doing the plantar flexion. So the mainly we have, while talking about the relation, we have talked about the pointer teres, the peroneus tertius. We talked about the extensor digitorum longus, extensor pollicis longus, and the tibialis anterior. We have read about the four muscles which are related anteriorly to the ankle joint, and these four muscles, if we put over here, then our question will be solved that the dorsiflexion is being produced by these four muscles. But here lies the question that tibialis anterior is the main muscle for doing dorsiflexion. Tibialis anterior is the main muscle responsible for doing the dorsiflexion, but the other three muscles, the pointer teres, extensor digitorum longus, and extensor pollicis longus, they support the tibialis anterior, or they are the accessory muscles for doing the dorsiflexion. All the four muscles, they are on the anterior surface, anterior part of the leg, they are on the dorsal part of the leg, they are related anteriorly to the ankle joint. Now we talk about the plantar flexion. Since the posteriorly our this calf must the bulk of the leg, the bulk of the leg on the back is produced by the gastrocnemius and the soleus. Gastrocnemius and the soleus. So we have got the gastrocnemius and the soleus, which we haven't mentioned over here. So the gastrocnemius and soleus are the main muscles which are responsible for doing the plantar flexion. If you do this movement, plantar flexion, and you feel the lower end of your leg, you will find the tightness of the tendoachilles tendon. You can feel the tightness of the tendoachilles tendon. That means the tendoachilles is the tendon of the gastrocnemius and the soleus. So this gastrocnemius and the soleus are mainly responsible for producing the plantar flexion, but they are assisted by, we have read about the relation on the posterior aspect of and the medial aspect of the posterior and medial aspect of the ankle joint. So tibialis posterior extends flexor digitorum longus, flexor hallucis longus, and the plantaris of course, which is on the back. So three muscles along with the plantaris are responsible for doing the plantar flexion, So this is all about the movement of the ankle. So the normal dorsiflexion is produced by all the muscles which are on the anterior part, and the plantar flexion is produced by all the muscles which are on the posterior part of the leg. Now we move on to blood supply of the ankle joint by the anterior tibial artery, posterior tibial artery, and the peroneal artery. These are responsible for supplying the blood supply to the ankle joint, and regarding the nerve supply, it is by the deep peroneal nerve and tibial nerve. So the anterior tibial artery, posterior tibial artery, and peroneal artery are responsible for supplying the blood to the ankle joint, and regarding the nerve supply, it is the deep peroneal nerve and the tibial nerve which are responsible for supplying the motor and the sensory part. The deep peroneal nerve do the job of the sensory, and this tibial nerve do the job of the motor one. So they are responsible for supplying the nerve supply to the ankle joint. Now we talk about the applied anatomy of the ankle joint. So number one is the most commonest part of our entire limb which come across or which suffer from the sprain is the ankle joint. The sprain is a word is mainly meant for it's not the mainly, but most of the cases in the outdoor, if 10 persons are coming with the sprain, that means of the 9 out of 10 will be of having the sprain of the ankle joint, sprain of the ankle joint. So it is a sprain of the ankle joint is so common. What happens in the sprain? Normally, this ankle joint is being supported or reinforced, or stability of the ankle joint is just because why? Because the inferior end of the tibia and the upper surface of the talus snugly fit into the ankle joint. We have got the lateral malleolus and the medial malleolus, which from both the side they reinforces the ankle joint and is being supported by the deltoid ligament medially and the lateral ligament laterally, along with the muscles. They reinforce the ankle joint, so there is very less chances of the sprain. But it happens. The sprain of the ankle joint do happen, and what happens in the sprain? This is subtalar joint. This is the subtalar means sub means below, subtalar joint. Normally when there is abduction, what happens in abduction? This movement, if you do this is called abduction. We do this is called adduction. This is known as the eversion, and this inversion, and this is known as the inversion. This movement, if you do this is inversion, this is eversion, this is plant dorsiflexion, this is plantar flexion, this is abduction, this is adduction, and this sort of movement. So this is all about the movement. So what happens when we do abduction? Means the foot is moving away from the medial end and moving towards the lateral end. Foot is moving away from the forefoot. Forefoot means the distal part. This portion of the foot is known as the forefoot. So the forefoot is moving away from the midline, away from the midline towards the lateral side. Moving. So what happens? What will happen? So this angle will, this ligament will turn first, and some part of the deltoid ligament will also get turned. What happens when the sudden plantar flexion, in the case of sudden plantar flexion, the foot is in plantar flexion, sudden plantar flexion of the ankle joint, when the foot is plantar flexed and also inverted. The foot is this sort of movement happens. If this side of ankle happens, then the lateral part of the ankle joint is being damaged. The lateral part of the ankle, the ligament, the lateral ligament will be damaged. You do the plantar flexion and you do the inversion, inverted, the foot is inverted and plantar flexed, the lateral part of the ligament will get torn. But if you do the dorsiflexion, but reverse, if we do the maximum eversion, then the medial part of the medial ligament will be damaged. The medial ligament will be damaged. So when we do the inversion and the plantar flexion, the lateral ligament is damaged, and when we do the eversion, it is the medial ligament which is being damaged. In case excessive, not the normal, the excessive eversion of the ankle joint produces the damage to the deltoid ligament, that is the sprain of the ankle joint. The damage to the ankle ligaments causes the sprains, not the damage to or fracture of the bone which causes sprain. They are known as the fracture. But if there is a injury to the ligament, that is known as the sprain of that particular joint. So normally when we walk, how we walk? When we start with the foot is plantar flexed, and when we walk, when we move forward, then the foot is dorsiflexed, that the heel touches the sole, and it is the dorsiflexus which comes in the action, and the heel touches the sole, and the foot goes upward. And to begin with, when we begin with, we do the plantar flexion. We do the plantar flexion. Then when the heel touches the ground, when the heel is raised. In cases of when we start walking, then the heel is raised. Then the heel is raised and the foot touches the ground. And when we walk forward, then the heel touches the ground and the foot is raised. The dorsiflexor is active while the walking started walking. When you start walking, it is the plantar flexors which are active. Now finally, intra-articular injections of the joints are common. For giving the intra-articular injection in the case of the ankle joint, this point is very common. That is between the extensor of hallucis longus and extensor and tibialis anterior. You go over there, and there is no chances of the injury to the nerve and the vessels. So this is the site of the needle insertion. So if you have to put the needle into the ankle joint, it is between the extensor hallucis longus and the tibialis anterior. This is all about the movement and the applied anatomy, and of course the subluxation of the ankle joint is there. Subluxation means this entire joint, dislocation means the joint get dislocated, either this or that. So what happens in that condition? If the foot is everted, then along with the deltoid ligament in the sprain, the medial malleolus will get fractured and the foot will get dislocated. In case of eversion, if the excess of eversion is there, then the lateral ligament will be torn, the lower part of the fibula will get torn, and once this or that pillar is torn, there is high chances of the subluxation or dislocation of the ankle joint, but this is a very rare condition. So this is all about the movement of the ankle joint and the applied anatomy of the ankle joint. Thank you.